For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October. Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at locations statewide. There are no polling places, so be sure to mail your ballot by October 27.
Hawaii votes by mail.
Aloha, happy Monday. Thank you so much for joining us here on Spotlight Hawaii. I'm Yenji Denise, joined by Ryan Kalei-Suji. This, of course, is a conversation about what's happening here in Hawaii. We're focusing a lot on COVID-19, and we're also talking politics. This is a conversation sponsored by the Office of Elections. A reminder that tomorrow is the day that they suggest you mail your ballot by. So if you're still sitting with that at home, try to get that in the mail today because, Ryan, we are looking at an election very soon.
That's right. A little over a week away. So make sure you drop that into the mailbox. There's other opportunities, of course, to make sure that your vote is counted. You can head over to the elections website for more information about that. Today, we're continuing on in our conversation, welcoming a guest that always receives a lot of question and a lot of engagement. Lieutenant Governor Josh Green joins us this morning, fresh off his shift overnight at Kohala, flew into Oahu, and now joins us here this morning. Lieutenant Governor, great to see you. Let's start off talking about the island that you came from. 51 cases yesterday reported on Hawaii Island, the largest single day total, actually more than Oahu. What's happening there on Hawaii Island, and is that a concern of yours right now?
Sure is. That's community spread for the most part. A big number of individuals are positive down on the Kona side, particularly from the Pacific Islander community, the Micronesian community more specifically. So there's been a lot of community spread, and there is some spread in different parts of the island. So we worry about this because there's limited healthcare capacity. As of today, a total of 9 individuals are in the hospital only on Big Island, and that's a good thing between Kona and Hilo, but that number could get out of control quite quickly. So lots of tracing and testing going to go on in the next couple of days.
How do they get that under control? Because as you said, they have very limited resources. Is the state doing something to help with that? Or, is it time to do something like what Mayor Caldwell and the Surgeon General did here on Oahu, where you have massive testing? Obviously it's a very big island and they're cash-strapped resources, but is it time for a big testing push there?
Not in that way. Mass testing used in that way is very low yield. When you do asymptomatic individuals that are not close contacts, you end up spending millions and millions of dollars and you get very low rates. They did over 60,000 tests. I think they got like 300 positives. What you want to do is actually do it right and test close contacts of those who are positive. You therefore just test hundreds and you actually find out where the cases are. That's been a large misconception for some time.
Let's also talk about the island of Lanai that's also seen this large outbreak. We know that they will be going into a stay-at-home order beginning tomorrow. What are you recommending and what is sort of the process at this point in time with it, such a high community spread going on such a small island with limited resources?
Now, in that case, because the island is so small and everyone lives so closely together, they're testing over 1,000 people right off the bat. And that is valuable because there was extreme proximity. There was a gathering. I know we reported they're 78 to 80 positive right now. I'm assuming that number is going to continue to rise pretty significantly. So we've been talking about that most of the morning. Department of Health is taking extra resources over. We've begun the discussions about getting some extra healthcare services there. Very limited healthcare resources on Lanai. They have a wonderful little clinic, and then Straub has a small presence, but if there are people who need hospitalization, they will tend to get transported over to Maui. Remember that our hospitalization rate has been 7.2 people out of every 100. So as of now, we can expect, based on the 80 or so cases, 5 or 6 people to need hospitalization for COVID. And on Maui today, we had 2 people in the hospital with COVID-related illness. So they have plenty of capacity. That's going to be a big thing for us. I do think they're going to test all close contacts, but because they all live together, everyone becomes a close contact quite quickly.
And when do you think that testing is, when is that testing actually going to happen?
It's happened. I think they've already tested like 800 or 900 people. They're going to test, they tested very thoroughly on Saturday. They're going to test another massive test run again on Saturday, which is kind of a good way to do it because you have that 5 or 6 day incubation period between when someone was a close contact and when they actually start manifesting symptoms and are more likely to test positive. In the meanwhile, as you know, tomorrow they'll go into the lockdown, so they'll greatly decrease spread. At the end of the day, remember, the real prevention is masks and social isolation, social distancing. The testing is just a way to give people kind of an understanding of whether or not they caught it, because so many people are still asymptomatic.
You know, speaking of masks, we know that you made a statement yesterday via your Instagram calling for a statewide mask mandate. Can you talk us through sort of what your recommendation would be for that? Is that something that you're going to be speaking with the governor about and the mayors about? And what are you sort of recommending in this sort of mask mandate?
Just something a little simpler. We have county by county orders, but it does confuse people. And I'm not being critical here. I think we need the mask mandate. One simple mask mandate, instead of people getting hit with a misdemeanor offense that goes to the courts, it's very difficult for law enforcement to do it. I think the mask mandate for us should be very simple. It should be like the jaywalking laws. You're not wearing a mask outdoors, you get a $100 fine. That's it. And that will make sure everyone wears a mask through the end of the year at least. That is what I would recommend, because if we can get up to 95% mask wearing rates, even over 90, but over 95% has been the evidence across the globe, you see very steep decreases in COVID spread. Until we do that, until we get people to buy into that, until we can express that to travelers very clearly, it's going to be hard to stop spread. I have all kinds of data to share with you today, but everyone's worried about that. And I want to make sure people understand that most of our spread has been community spread. And now that people are going back to work, we have to double down on mask wearing.
Let's talk a little bit about some of the data. One of the things that I wanted to ask you about as we went sort of island by island was Kauai. We read today that someone there has tested positive, someone who actually did the traveling pre-test tested negative, and then did one of the voluntary programs and tested positive and is now quarantining there. What can you tell us about this sort of secondary testing, and does this speak to a need to have more of it?
Because we had one positive?
Yeah. Well, I think the people seeing that think, okay, he got through and he was negative. So, and then he was, obviously flagged because he was positive on the secondary testing. So do we need more secondary testing, because how many others are getting through?
Well, we've done over 9,000 tests and we've had 5 positives. So the rate of travelers coming in is far lower than our own local rate of COVID. So I hope people will understand this. Far lower with a pretest, tiny numbers, versus our own base rate, which is higher, where we're seeing, hundreds of cases in clusters. If we're smart, we'll be testing the clusters. We'll be testing close contacts. If we're stupid, we'll test massively and get low yields. So we have to learn. We have to learn. There's a long-standing concern that it's always the other guy. It's always somebody else. And look, everyone should wear a mask. Everyone, if they get symptomatic or is a close contact, should be tested. But as long as we have that misconception that it's the other guy causing our problems, we're going to miss what's here at home. We're going to miss the spread. We're going to miss the explosive spread on a Lanai or in Kona. And it's very unfortunate, because it's so easy for people to point the finger elsewhere, when really what we have to do is just be responsible, like every community across the country, to prevent spread. That's why we should always be talking about masks and not secondary tests. That was a large mistake to focus on that. But I understand that it's human nature to worry about threats from outside. But we shouldn't make the mistake, because we should do what's necessary to stop the pandemic. I don't know what else I can do. I brought Dr. Fauci in to express that to us. But I'll keep working both sides. We are going to continue to support voluntary testing. We're doing the surveillance study now, and so we're inviting thousands and thousands of people to do it. Like I said, the initial data, and we'll get weekly updates from Dr. DeWolf and his team, DeWolf Miller, that is. But the numbers are utterly small. And it stands to reason, because you take rates that are not that high in the mainland, though they're going up. We still have the test. We're the only state aside from Alaska that has the test. And then we still offer some additional surveillance. But if we spent this much energy on mask wearing, we wouldn't have a pandemic here. We just wouldn't.
Let's spend a little time talking about some of those numbers that you've already noticed with this pre-testing program. Of course, we know that we are a few weeks in now. What have you seen? What sort of data are you looking at and examining as we sort of look through this initial wave of people that have entered our islands?
Sure. Yeah. So I'm looking down at my notes because there's a lot of numbers here. So in the first 12 days, which took us up through midnight last night, we've screened 88,170 people. So 88,170. Of those individuals, 75,777 have received exemption through getting the proper test through our program, through the Safe Travels program. And then 9,578 individuals have gone into quarantine. Now, just so people know, the number doesn't add up because some people have been getting screened, 2, 3, 4 times because they're moving around a lot. So that's pretty good, actually. So it's about 10 or 12% of people have been going into quarantine. The breakdown on residents versus visitors returning to Hawaii, traveling to Hawaii, has been almost exactly 2 to 1. So we've had 59,035 visitors in the first 12 days. So, you can do the math very quickly. It's about 5,000 visitors a day. And that exceeds what we had thought. Some people were predicting 2,800, so 5,000, a lot more. And then we've had 29,000 residents, 29,135 residents come back. So it's 66.3% have been visitors and 33.7% have been residents. And so it pretty much plays out, my understanding is also for those who are going into quarantine. Now, there's bumpiness, there's no question, but we're erring on the side of safety precisely because people are so concerned, right, about travel from the mainland. Though really they should be worried about travel from home to their workplace. That's the travel we should be worried about if people aren't wearing masks and they're not wearing masks during the day. But that's the breakdown for us. And it's gone very well, though there are some people who are getting stuck in limbo because they didn't get the right test or they got their test too late. And we're going on a first come, first serve basis. I know it's frustrating. I feel for people. I've personally intervened in a few cases where someone's test got lost, literally that the swab got lost and we got them a second test, but trying to keep it real tight because we don't want anyone to be concerned that someone's breaking the rules.
Speaking of breaking the rules, let's get to some audience question. Jean Peahi asked at 10:40, Ryan, we went to Waikiki Beach yesterday. We were the only ones wearing masks. All the tourists sitting around us were not. Let's talk about mask compliance, because you said that if 90 to 95% of everyone, locals and tourists, were compliant with mask wearing, that we could really get this under control and perhaps get to the mayor's tier 4 status, which I know a lot of people would really like to be in. What is the mask compliance? Do we have any idea of how many people are actually wearing masks when they're supposed to be doing that? And is this impression that Gene's sharing with us that tourists are not complying, is that accurate?
I would never question Gene. I don't know exactly what his observation was. The number on Oahu has been hovering around 85% overall. There could be people that are tourists and they're not cluing in. We've got a public service announcement running constantly at the airport when people come in, signs. We're trying to share the information as much as possible. They get on the plane when they fly over, and they will get busted if that happens. But the police and the counties are going to have to continuously work to police that and to enhance whatever they can do. But it's just too much. That's why I've asked for something simpler so that they can just quickly pass out tickets and that the tickets can be promoted at the hotels. We want something simple. If it's complicated and it's a misdemeanor, it's never gonna ultimately work. Now, this idea of it being tourists, it's hard. It's hard to point fingers once again of those individuals unless they are skipping out on their quarantine, which is a serious violation. These individuals have just been tested, all of them. A huge percentage of them have just got a negative PCR test, and as our data is showing, it's like about 1 out of 1,800 people have been positive based on the rate. So it's lower risk than what you'd expect if people are, say, at a restaurant or something, and it's just our own local background rate of COVID. But everyone should wear a mask, and at the beach, people should definitely do it. That's the statute, or I should say the emergency rule.
As we see these case numbers rise on the neighbor islands like Lanai and on Hawaii Island, and with Oahu's numbers going down somewhat, we know that there is an order to make sure that there is that quarantine in effect for those those leaving Oahu to the neighbor islands. but the neighbor islands do not have to quarantine or have to take that pretest when coming to Oahu. But with the neighbor island cases going up, could that be something that also would have to be implemented as we see more of those case numbers rise?
For sure, that could definitely happen. I mean, they're going to a quite extreme actually on Lanai. There's actually going to be a stay-at-home order, right? So that's the ultimate in security measures. But the reason that we didn't have the quarantine order for travel from the neighbor islands to Oahu was because the Oahu numbers were almost the entirety of cases for 3 months. I won't be surprised if the mayors discuss that. There's a leadership meeting today at 11:15. They probably will bring that up. The surges have tended to be in clusters overall, and the clusters have been culturally focused on Pacific Islanders at a higher rate, which is just something to observe because then we know how to address risk. But we're going to be rolling through this kind of problem constantly for the next 3, 4, 5 months. There's going to continuously be little ups and downs. I do have good news though. What has gone on has greatly diminished the number of cases in the hospital. I think today we were down to 59 cases in the hospital. You'll remember at one point we got up to 318. We spoke about on the program once. So, we're like down 80% now, which is great. And we've kept our numbers very flat. So we have a rolling number of about just under 1,200 people in the last 14 days. And that number has been very consistent statewide. So that will tend to mean a low risk for fatalities and low risk for hospitalizations, but it'll be reflected on the neighbor islands just like it's reflected here. And Maui has a total of 29 ICU beds, Big Island 24, Kauai 9, Molokai 0, Lanai 0. So you get the idea. If there's an outbreak on Lanai and a bunch of people need to go in the hospital, they're going to have to be transferred, right? Because they can only just stabilize people. That's what also we see in the rural areas, like the hospital I was in this weekend in Kohala. We don't have an ICU. So if someone gets very sick, we transfer them to North Hawaii or to Kona. So these are the challenges that we'll keep facing. And each week that passes, I kind of say a little celebratory prayer because we're getting closer to the vaccination, at which point we can at least protect very vulnerable populations first. And then we will get to a place where we won't be quite as panicked about outbreaks.
Let's talk about Halloween. You've got kids, obviously, and a lot of adults like to celebrate as well. There are some concerns that this could be, our next 4th of July, if you will. What are you advising when it comes to Halloween? And should there be, are you recommending? I know it's obviously out of the state's purview. It comes down to the county police. But what are you suggesting when it comes to also enforcement?
I hate to be a drag, but we should not have Halloween parties this year. Really, we have to follow the county statutes and orders. We should not gather more than 5 people. Halloween it's a risky holiday in the sense that it promotes people going up and seeing lots of people in series. So going house to house is about as bad an idea during a global pandemic as you could have. So I think we should just have a whopper of a Halloween in 2021 and probably let this one be chill and take pictures with our kids and buy gift bags and candy for them. I may be a doctor, but I support candy on Halloween for sure, but just not door to door. So if they could honor us with that, behavior, just don't do parties this particular Halloween. Because the downside of it is for a wonderful Halloween, we will get an explosion of cases and we'll have to go backwards in the tiers on Oahu or wherever else. And can you imagine losing our capacity to have people economically active or getting our schools open sooner rather than later just because we wanted to pass out candy? I mean, that's not going to be a good idea. So probably not the year for Halloween trick-or-treating. And then next year, let's go crazy on it. It'll be great.
Another question that has just come in is about schools. With these rising numbers, when do you think in-person schools will resume? What is sort of the outlook with schools? We know that there is, these continued talks of distance learning combined with some in-person. What are your thoughts moving forward as we continue to see these numbers and what that outlook looks like for in-person class once again?
Well, out of respect to Rain, I just wanted to clarify. I mean, the numbers aren't rising; they're falling. So the numbers have been falling in general on Oahu. The numbers have risen in two separate tiny areas. They've risen in Ocean View on the Big Island and then on Lanai. So Lanai may have to go a little more carefully or slowly because of the case numbers, but where we have our largest population base, the numbers have been falling. I think the number was 49 cases on Oahu, where we have 1 million people yesterday. So I think that bodes well for opening the schools after the new year for in-person learning. I think that we still have to respect whatever people's wishes are as teachers and family members. Parents have to be able to choose what they want to do from a safety standpoint. But that opening will also coincide with some availability of vaccination, I hope. And we know that we will offer vaccinations to teachers and educators in general, hopefully in a kind of expedited way. The first group is going to be the very elderly, our kupuna, and healthcare workers because they're exposed all the time, but teachers are pretty high up there as a priority. I think in January, I can't imagine we wouldn't start sending most kids to school. My daughter is in school full time now. My son is not, and she's lucky enough to go to one of the private schools and they had a lot of extra resource and they're doing very well. Sammy has a wonderful charter school, but they're waiting on it till January 3rd, I think.
Let's talk a little bit more about the visitors who are coming here. I'm interested to know if we have a profile of who actually is coming, who, the pent-up demand, if you will, who, Hawaii was before a large vacation destination for families. I'd imagine that, there's not a lot of families, but who's coming here? And do we know, it's obviously, we're less than 2 weeks in, but do we have an idea of what the economic benefit is to having all of these people start to come back?
Yeah, let me give you a chart here. Reason for visit out of this first 88,000 people that came. And some of them are little crossovers, but vacation, 40,000. People visiting friends or relatives, 23,000. Returning residents had been, as I told you, 39,000 individuals total. Yet airline crew and essential workers, some of this is overlapping. Military was a 5,000 person number. So a lot of vacationers, travelers, visitors, in other words, for every 50 visitors that we have, it creates a full-time job in the state of Hawaii for a year. So when you look at the economics of this, so when we've had, what did I tell you? 59,000 visitors, that's like 11,800 full-time jobs will be restored. You'll see those numbers start being reflected in our unemployment numbers. That's pretty good, even though we've really had just a trickle of people. And importantly, the surveillance testing has shown extremely low rates of disease. Among the 9,000 tests done, like I said, 5 people have been positive. So it's hard to say what one would want to do beyond that. We will do a lot more testing. We'll do constant surveillance and we'll do constant assessments of how it's working. And that's all laid over top of how we're doing in our state, the daily case count and the hospital count. That's what it looks like so far. I can also tell you where people are departing from. 11,000 from LA, 10,000 from San Francisco, 7,900 from Seattle's airport, 7,800 people from Honolulu International Airport going to the neighbor islands, right? Dallas had 2,500 people, Phoenix 2,700. So there are people coming from different places. I think we should be, in retrospect, I think we should be glad that we set up the pre-arrival test, because we would all be concerned with the surge that if we didn't get a pre-arrival test and from a partner that we can trust, that we can verify the test, we probably would be freaking out. But we shouldn't be freaking out based on these numbers right now. We just should be careful.
I want to bring in another question. This is Nancy. She actually has a lot of questions in this one, so we're just going to maybe tackle one. But can you please talk about the guidelines for surveillance testing and post-arrival voluntary testing for visitors, how it varies county to county? Are numbers being reported? Is a visitor notified? If positive, are they being contact traced of positive? If maybe you can speak more as an overview of sort of this surveillance testing and what you're seeing from that. I know that you talked about it briefly at the top of the show, but what are some of the things that you are expecting to find from the surveillance testing thus far, as well as some of the second testing that is happening on the neighbor islands?
Sure. Leave this question up because it's complex, if you don't mind. So, okay. The guidelines for surveillance testing. So it's all voluntary because you can't mandate people getting a test. You can't force someone to have something invasive done to them unless they are refusing to follow the state's law on quarantine. People can be asked to go into quarantine. We are asking, as of now, we started with 10%, and we're inviting more. We're inviting 10% of all the people to get the free test, like the 2nd, the 12th, the 22nd, and so on. It does not vary. Well, how can I say this? It's a randomized selection so that we don't get clusters from one group, okay? It's statewide, but the counties are also stepping up for the most part, which is very good. So Big Island is testing everybody on day 1. They're going to move on November 1st, I'm told, to day 4 testing. And that day 4 testing will probably be a little bit more illustrative of risk. Right now, they're doing day 3 testing on Kauai, and that's good. Day 3 or day 4, it's good because you have a space between the pre-test and the post-test. So there is some minor variability, and that will have to be worked out, teased out by the scientific data, the study partners, Dr. DeWolf Miller and his team. If a visitor is positive, yes, they are notified, as is the Department of Health, and then they would have to go into isolation. So that is definitely, we just play it by the book as far as health goes. Also, if they are positive, then their close contacts have to spend 14 days in quarantine. These are the challenges to get people to participate, but a lot of people are participating because they understand that it's valuable. Also, if anyone does test positive with an antigen test, we do a confirmatory PCR test to make sure that there's not a false positive. So far, on the Big Island, there were some false positive tests. The false positive tests of the first, for instance, 10 positives, only one of them was actually a true positive, confirmed by PCR. So we're doing a thorough job to make sure that the testing is accurate, because we don't want to give someone a false positive, which you see with antigen tests, and condemn them to isolation when their test wasn't actually a positive. It's a pretty complex task, and I'm really grateful that people are chipping in and working with us. We'll get more data each week as the weeks go by. And ultimately, if we have to invite a lot more people or incentivize it somewhat, we will. But the early data does seem to be robust enough that I think we'll know that travel is pretty safe, but not if people aren't wearing masks, like that one observer noted.
Mm-hmm. Looking ahead, we know that another one of the responsibilities that you have, of course, is creating the vaccine program for Hawaii and helping to manage that. I know we're, still months away from that becoming a reality, but how are you figuring out who to prioritize and what can people expect when that comes to pass?
We're doing a few things. First, we took the federal guidelines, which are pretty uniform across different regions. Everyone knows that you want to, in this case with COVID-19, you want to provide extra protection to individuals that are elderly in institutions like long-term care facilities, especially first responders and healthcare workers. Those everyone has agreed on. And then each community has some additional nuance. For example, we're having tons of stakeholders. I think it's over 100 different stakeholders, from the Pediatric Association to private clinicians to epidemiologists to large organizations here in the state. We invited many, many people to the table to give their input, because we do have some differences to the mainland. For instance, as we've talked about on a couple occasions, the Pacific Islander community, though it represents only 4% of the population, was actually representing 31% of all cases. So there may be some benefit to do some additional immunizations in that subset of our state, so that those individuals don't catch and spread else to other people. So we want to have it be as high yield as possible. The first batch of vaccinations is probably for all states just going to be about 10% of the total needed. So it'll be for the highest risk categories, followed about 2 to 3 months later when manufacturing ramps up to a huge, huge number of vaccinations. So at first you'll see the highest risk groups, but that small percentage will probably prevent 50 or more percent of the worst outcomes, because vaccinating an individual that, say, is in a nursing home or is a nursing aide that works in a nursing home, if he or she doesn't catch it and doesn't spread to the patients, we don't see fatalities. If instead someone who is 22 years old and is a server in Waikiki they are so low risk to actually have a bad outcome that we can continue to do what we've been doing, which is contact tracing and testing as needed. They'll be the last category, probably, individuals that are young and healthy that will get vaccinated. We just did the first draft of the plan, which we put out on the 16th, I think, of October, because that was the federal requirement. There are still some pukas in the plan because we don't know yet what vaccines they're going to approve. There probably will be at least 3, maybe 5 vaccinations. There may be one that is a single shot, which, if it's effective, I can imagine a lot of people will want a single shot rather than 2. We have to have guidance on things like what do you do with a person like me who actually had COVID and it's 4 months later, or any of us that caught the disease. Do you just get a booster? So a lot of these questions will get answered and they'll go into the next draft of the report. Meanwhile, much of this is logistics. It's going to cost as much as $25 million to get, even though the vaccine is free to the people that get it. It's going to cost about $25 million to have multiple sites set up, to make sure all of the safety precautions are in place, to have all the data. It's an incredible lift. So I'm grateful that General Har's team is on this. Department of Health is on this. It's important. It's kind of it's our ticket to freedom in some ways if people want to get the vaccination. Not everyone will, and no one's going to be forced to. I know people are thinking that. But look, if I'm allowed to take the vaccination after having had COVID, and if it will give me more immunity, I would take it personally, because I hate getting locked down.
All right, we know that half an hour always goes by really quickly with you guys. We cover so many topics, and so as our time wraps up here, your final thoughts, maybe for the viewers as we head on into this holiday weekend with Halloween this weekend, and any other thoughts that you have for the viewers.
As to Halloween costumes, I highly recommend masks that cover your mouth and nose. That would be great. Look, I love Halloween, and I miss having some of these festivities, but just be really safe. It's not worth having an outbreak over Halloween. Maybe we'll bundle a couple holidays once we get past the vaccination, and I'll host a costume party, but it's really important that we have a good, safe fall. The numbers have been surging on the mainland, and we expect that in the winter time when people go indoors. So if we have to ramp up our security here, we will. We'll certainly continue to, give everyone the transparent information as it comes in. And if people want to do extra testing, I think it's good too. So a lot of these things have been working well, but we can't let our guard down.
Okay, Lieutenant Governor Josh Green, thank you so much for starting your week off with us. We truly, truly appreciate all the information you shared with us today.
Take care.
Aloha.
Thank you. Well, Ryan, we covered a lot of ground and we still see lots of questions, specifically about enforcement. And that's important because we're going to actually have a guest on from HPD on Wednesday. So make sure you join us then, because we're going to be going through all the nitty-gritty of enforcement. A lot of folks simply don't know, wait, do I have to wear a mask while I'm exercising? I didn't realize I had to wear one at the beach. I saw a lot of the comments in there. So we're going to be going through that step by step with HPD Deputy Chief John McCarthy. So please do join us then. But he also covered a lot of ground, specifically when it comes to testing and the surveillance testing. And good to hear that they are not turning up a lot of cases in the thousands of tests that they've done on that secondary testing.
Yeah, and we also heard his reasoning for that statewide mask mandate that he's really pushing for to be implemented and stay implemented until the end of the year, he said, making it very streamlined and simple for people to understand throughout the state. He compared it almost to a pedestrian jaywalking violation. And so we'll see what happens there. We know that he continues to meet with other leaders in the state. And so if a mask mandate is something that comes out from these meetings, we'll see, or if they continue to keep it as is, which is broken down by counties with different rules, which, as he said, sometimes can get overall confusing for many residents as well as those visiting the islands.
Yeah, and you saw in the comments versus what he was saying, the real tension that we're experiencing now that we do have visitors coming back to the islands. There is a perception that those folks aren't wearing masks and they're putting our community at risk. But as he pointed out, the vast majority of those folks have had a negative PCR test pretty recently, And he's saying that it's really a lot of the residents who need to be more compliant when it comes to social distancing and mask wearing. But then I saw a lot of the comments really pushing back on that. So there is that tension. And the reality is that visitor or resident, everyone needs to be masking up.
Yeah. And so, I think that is something that a lot of tourism officials also knew, that there was going to be a lot of pushback from local residents about getting the message out. And the state has said that they will continue to do more to sort of inform those visitors coming to the islands of the rules and regulations. But as one of our viewers said today, she, traveled through Waikiki. I drove by Waikiki as well this weekend, and there was a lot of tents set up, a lot of people gathering. And so I know that there is a lot of concern out there in the community from those who are really trying their best to help to keep our numbers down. But again, that is something that we look forward to having that conversation with HPD on Wednesday to talk about how they are exactly enforcing this and how difficult this whole overall process has been for them.
Yeah, and then we took the long view looking at the vaccine, which, many of us are really looking forward to having access to that, because it could be a huge game changer for getting back to school and all the things, getting back to some kind of a new normal out of this new normal. And him saying that it's going to cost $25 million and probably only 10% of the vaccine that we need will be initially available. So they're figuring out who gets that. One of the people who is really also helping to spear that is Major General Ken Hara, and he's going to be joining us on Friday. We have not heard from him on this program in the whole time that we've been doing it, so we're very excited to have him. He, of course, is the head of HAIMA and has been working very hard to help with the COVID-19 response statewide.
Yeah, looking forward to that conversation. And again, thank all of you for your comments. The Lieutenant Governor always attracts a lot of viewers and a lot of comments who, of course, people are passionate about it. We thank you for your comments and for sending your questions, and we'll continue to bring in guests that will help to answer some of the questions that you have and things that you are experiencing through this pandemic. We also want to thank our sponsors, the Office of Election. Again, reminder, tomorrow is the last day. If you still have your ballot at home and have not mailed it in, tomorrow is the recommended deadline for when you actually vote and put your ballot in the mail. If you want more information, please head over to elections.hawaii.gov, where you can actually also track your ballot to make sure that it was received. And if you somehow miss that deadline tomorrow, there are other opportunities for you to drop off your ballot at different voting boxes, as well as to actually vote in person. You can find all that information on their website. Again, elections.hawaii.gov.
And until then, we'll see you on Wednesday with HPD. We invite you to stay safe, treat each other and yourself with aloha, and we'll see you right back here at 10:30 Wednesday.
For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October. Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at locations statewide. There are no polling places, so be sure to mail your ballot by October 27th.
Hawaii votes by mail.